Hey, Dr. McNamara here, and today I wanted to talk to you guys about a common condition that I see often in the office, and that is tennis elbow. We see a lot because our patient population, they play a lot of paddle, they play a lot of tennis, and that's essentially why they call it tennis elbow, because of that chronic wrist extension and that repetitive movement. Now, the musculature involved in tennis elbow, that happens on the outside of our arm, if our arm is at our side like that, and the musculature involves the extensors of the wrist that cause our arm to do that, as well as the supinators of the wrist. You have a big muscle called supinator that also inserts on that common extensor tendon. So we're going to work that tissue primarily. The first thing you're going to want to do is release the musculature and kind of clean up the area and do some myofascial release. So with that, you'll take a little bit of emollient and just place it on the place you want to start. And then I'm going to use this gua sha technique, and then I'm just going to work that elbow. Work that lateral epicondyle and that common extensor tendon all the way down into the wrist. You can see how it's getting nice and red. So what you'll do is you'll do this for a few minutes, about 1 to 5 minutes or so, or until you start seeing little red dots coming up, and that's called petechiae, and those are just little micro blood vessels that are popping. So that is normal. You may get a little bit of bruising, and that's totally common as well. After you get that myofascial release of the common extensor tendon, we're then going to want to perform some exercises to help increase the strength and improve the function of the muscle. Now, you can start doing some stretches at this point, but it may irritate the condition. So if it does, hold off on the stretches for now, and we'll stick with isometrics. So the first isometric that you're going to do is we're going to work wrist extension at different ranges of motion. So if it's more comfortable for your wrist to be down like that, that's where we're going to start. And you're just going to apply pressure in that direction, in that extensor direction. And you can just hold for about 30 seconds to a minute. And then I want you to try to do different angles. And if there's any pain, what I want you to pay attention to is if there's any decrease of pain while you're performing the contraction. And that's a good sign that we're heading in the right direction. Generally, isometrics have an analgesic effect, and they can kind of help with those. After that, we're going to then want to perform some eccentric exercises. And a simple way you can do that is by using a weight. And then what you'll do for this is you'll lift the arm up. So the concentric portion of the contraction, you're performing passively. Then you're going to lower really, really slowly. And you don't need a lot of weight. I got this cute little 3-pounder here, and that's good enough. And you'll do that for about 5 to 10 repetitions for about 3 to 5 sets or so. Another way we can perform the eccentrics for the wrist is you can take one of these TheraBand flex bars. These things are awesome. And for this, what we're going to do, so we want to work eccentric contractions. So that means the muscle is going to lengthen as it's contracting. So for this one, we're going to start with it in the affected side. So what you're going to start with is you're going to start with that wrist in a little bit of extension, okay? So you can passively do that or actively do that, whatever you're capable of. Then you're going to twist with the other arm and then come to this position, this neutral position. See how my wrist is in that contracted position? From there, we slowly, eccentrically contract it, and then you can repeat. Just like that. Great way to get some eccentric contraction in that wrist. All right, some more isometrics. So I mentioned that the extensors are a part of that tennis elbow, that lateral epicondylitis. Another major component is that supinator muscle. So to work that eccentrically, what you'll do is same kind of thing. You'll start in a pronated position. Generally, this is going to feel a little bit better since we're not activating the musculature that will supinate the wrist. You're going to start here, and you're just going to resist rotating your wrist that direction in supination. So start with an isometric there, move to the next level, isometric there, until we're all the way turned over, and you can actively perform that movement, okay? So that's about full range for me pulling that supination isometrics. To do the eccentrics with that, you're going to start just like this, and you're slowly going to actually pronate it, and then that's going to eccentrically contract the supinator as it is lengthening, okay? Back to neutral, like that. Another eccentric exercise that we're going to want to perform is for the brachioradialis. That's a muscle that comes from the bicep into the forearm. And for this one, all you're going to do is hold a dumbbell and then just start tilting it forward just like that. This would be the eccentric way to do this. Isometric, push, different ranges of motion. That covers that. Now, as a little bonus, I'm going to show you guys another common muscle that is involved in this, and that's called the Anconeus. Now, the Anconeus muscle never gets any respect. Shout out Rodney Dangerfield. It's a muscle that helps with tricep extension, and it can kind of reproduce that elbow pain. So a good way to retrain tricep extension and to work the Anconeus muscle is you're going to go to the back side of your elbow, and generally it's kind of lateral to the olecranon process, and you got a meaty little pad there that might get sore. If that's really, really sore on you, that's a sign that the Anconeus is a little bit inflamed. So what you're going to do there is just place that right underneath that bony prominence, the olecranon process of the elbow, and you're just going to work just some wrist extension in there, and then kind of go lateral, medial, get some supination in there. Okay, just like that. Next, what we're going to want to do is we're going to add a little bit of Kinesio tape. So this is a little bonus in case it's really, really sensitive to touch, things like that. There's a little bit of inflammation. This will desensitize the tissue to the pain, as well as help remove some of that accumulation of fluid by pulling up on the lymphatics, and it's just going to help the muscle function a little bit better. So the way we're going to apply this is make sure the elbow's dry. So what you're going to do is you're going to bend the arm, you're going to place the tape on that lateral epicondyle, and then just apply some stretch and try to get it all the way down as low as you can get to the wrist. Okay, and then this is heat activated, so I'm rubbing in the tape so that sticks a little bit better, okay? Okay, and then that's for the extensors, so that's going to help with that extensors. Then we got to work the supinator as well. So for that one, we'll pronate the arm as much as we can, and then start at the same spot, and you're going to go kind of down the arm at a 45-degree angle or so that can follow that supinator muscle and aid in supination. Once we're completely out of pain, these wrist motions no longer are affecting us, they're no longer causing any pain. We then want to also work the joints above and below the elbow in order to make sure that the elbow isn't compensating for a lack of range of motion in either of these areas. So check this out. So now that our elbow is pain-free, we want to start working the joints that are below and above the elbow, so meaning the shoulder and the wrist. The way we're going to do that is a simple dead hang. So to start doing a dead hang, don't let it control all your body weight, especially if you don't have the strength to maintain it, okay? And you can start two-handed also, even though the tennis elbow may be affecting one arm. What this is doing is it's pulling traction on the wrist, so it's stretching out that wrist joint, as well as tractioning the shoulder joint as well. From here, what I can then start doing is internal and external rotation of the shoulder, just to really make sure I get full range of motion in that joint, and that should help end any type of compensation that you're having in the elbow in order to compensate for a lack of range of motion in the shoulder and or the wrist. I hope you guys found this information helpful, and if you know someone who's suffering from any type of elbow pain, send them this video. If you like this information, check out our channel for more health and wellness. Thank you.